So my name is Israa Al-Shakarchi. Thank you very much for asking me, to Nick and colleagues, to speak today. I am going to do a whistle-stop tour about understanding arthritis, just so that you've got a bit of an understanding of what it is and what we're looking for and how we can help you, essentially. So we're going to go through what is arthritis, how common it is, who gets it, what are the main types, what are the main symptoms, when should I see my GP, how's it diagnosed, what are the treatment, and then we can go through questions at the end. I was going to go through some supportive things, but given my two other speakers today, they have covered most of that. So arthritis is defined as a painful inflammation and stiffness of the joints. And there's two broad types of arthritis. There's either inflammatory or non-inflammatory arthritis, and I'm going to go through them in more detail a little bit later. But how common is it? So osteoarthritis, or OA as it's commonly known, is by far the most commonest type of arthritis in the UK. About 10 million people in the UK have it, which is about 1 in 6. Gout, which I'm sure many of you have heard of, which is commonly in the big toe, is the most common inflammatory type of arthritis. So that affects about 1 in 40 people. And rheumatoid arthritis, which is the most common inflammatory autoimmune. Autoimmune means that your body is attacking yourself and causing the inflammation. So rheumatoid arthritis is the most common autoimmune inflammatory arthritis. And about 1 in 100 people in the UK has got rheumatoid arthritis. Each year, 1 or 2 men per 10,000 and 3 or 4 women per 10,000 get rheumatoid arthritis. So actually it's not very common, and not that many people get it more commonly each year. Although post-COVID, I think we have seen an increase. So who gets it? Well, it really depends on the type of arthritis. So we know that women are more likely to have rheumatoid arthritis or to develop rheumatoid arthritis. They're more likely to get some types of connective tissue disease like lupus or Sjögren's, whereas men are more likely to develop a type of inflammatory arthritis that affects the spine called a spondyloarthropathy or ankylosing spondylitis. Gout is more common in men, particularly in middle age, and osteoarthritis is more common as we age and can be seen in both men and women. Why would you get arthritis? Again, it depends on the type of arthritis you've got, but it might be related to your age. We've already said osteoarthritis increases with age. It might be related to your gender, your family history. You might have had an injury to a particular joint, which means it's more likely to be prone to degenerative changes like osteoarthritis. You might have other conditions that mean that you're more prone to getting, for example, if you have hypothyroidism, you may be more prone to developing another autoimmune condition like rheumatoid arthritis. That's certainly not something that's a given, but autoimmunity can mean that you are more likely to have more autoimmune conditions. Equally, if you have poor kidney function, that might mean that your ability to get rid of the crystals that form in gout is reduced, and therefore it's more common for you to have gout. Obesity increases the risk of certain types of arthritis. So as I said, there was 2 main types, inflammatory and non-inflammatory, and there's hundreds of different types of arthritis. But if we just look at autoimmune compared to, degenerative compared to, I'll start again. The non-inflammatory is osteoarthritis, that is wear and tear arthritis. And then if we have a look at inflammatory is split into 2, either autoimmune, which is your body producing the antibodies that lead to inflammation, or inflammatory but not autoimmune. So that's things like gout and pseudo-gout. And there's lots of different types of autoimmune inflammatory conditions: rheumatoid arthritis, psoriatic arthritis, reactive arthritis, which is a type of arthritis that happens after an infection, spondyloarthritis, which is a type of autoimmune inflammatory condition that happens in the spine, to list just a few. So when we look at osteoarthritis, that's the one that most people will develop in their lifetime. It's, as I say, the most common type of arthritis, and it's more common as we age. It most commonly affects the knees, the hip, the hands, and the spine. And what happens is the protective cartilage around each joint becomes worn and damaged, and then the joints can become stiff and painful and less mobile. And often the symptoms get worse with activity and improve with rest. And the key features are it develops over time. It's not something that will come on quite quickly, and it can affect one or several joints at any time, and it is not autoimmune. So this is a degenerative condition. When we look at an inflammatory arthritis, an autoimmune inflammatory arthritis, typically we speak of pain and stiffness with early morning stiffness, which I'll go into in a minute. There's often joint swelling. In people who have psoriatic arthritis, which is a type of autoimmune inflammatory arthritis in patients with psoriasis, often they've got a history of psoriasis. You can get constitutional symptoms, which means that you can just feel a bit tired and run down, just not yourself. You might lose weight. And there may be associated symptoms. For example, if you had psoriatic arthritis, I'd be looking for psoriasis. When we take a history and we examine patients with arthritis, we're really interested in the distribution of the joints. And I've tried to make this so that when you guys are all online and you're trying to get an appointment with your GP, that you can provide as much useful information to the GP as you can. So if you can tell the GP, where is the distribution of the pain? So for example, if you're telling the GP that you have hand pain, is it in the very furthest joints? Is it in the middle joints where your fingers bend? Or is it where your fingers attach to your hand? Because where the joints are affected helps both your GP and me as a rheumatologist to differentiate what type of arthritis you may have. I'm also interested in the stiffness that you have. So if we look at inflammatory autoimmune stiffness compared to degenerative symptoms in osteoarthritis, patients in rheumatoid arthritis or an inflammatory arthritis, an inflammatory autoimmune arthritis, will complain of pain and stiffness. The stiffness is usually worse first thing in the morning. That's what we mean by the diurnal variation. There's a change. It's worse in the morning and it gets better as the day goes on, and then it gets worse again in the evening. It usually lasts for about an hour or more than an hour, and then it gets better with activity. In osteoarthritis, you get some stiffness, but it might last half an hour, 45 minutes, or it may be no different at any time of day. So that's one of the biggest features. So the stiffness that improves with activity after greater than an hour, we're thinking inflammatory autoimmune. Stiffness that's just there but doesn't improve with activity is degenerative, like osteo. And symptoms often improve with rest with degenerative osteoarthritis compared to an autoimmune inflammatory arthritis. I want to think about the swelling. So is it a bony swelling? So if we look at this picture here, we can see that this is a hand, and you can, if you were to feel these joints, you would feel a nodular, hard, bony swelling. This is what you see in osteoarthritis of a hand. A boggy swelling is what we see when there's inflammation in the joints. And I hope you can all appreciate that the nice MCP joints, the metacarpal phalangeal joints, are very swollen, and if you were to press them, it's a bit like pressing on some Play-Doh. It may be warm, it may be tender, and it may feel fluid filled. So it'd be great if you could say to the GP, I have pain and stiffness. The stiffness is worse at this time of day or no worse at this time of the day, and is it bony, is it boggy, and where the distribution is. It's really interesting to work out whether it's symmetrical. And what I mean by symmetrical isn't it's involving my index finger, it's which rows of joints. So if we go back to the hands, for example, I want to know, is it affecting this row of joints? I don't mind if it's one joint or two joints or all the joints at the end, the distal interphalangeal joints. Is it the same on the opposite hand, or is it just on one side? Again, and I just want to know, is there symmetry of your joint pain? Because often symmetry helps us to narrow down the differential of the different types of arthritis that you may have. So rheumatoid arthritis, psoriatic arthritis, polymyalgia rheumatica, patients will complain of symmetrical joint symptoms, whereas ankylosing spondylitis, psoriatic arthritis, can be both types actually, and reactive arthritis is more asymmetrical. And there's also connective tissue diseases like lupus, which is more likely to be symmetrical, and enteropathic arthritis, which is a type of arthritis that's again autoimmune, that's related to having inflammatory bowel disease. So not irritable bowel syndrome, inflammatory bowel disease. So that's Crohn's or ulcerative colitis. So how do we make the diagnosis? Well, they've gone in the wrong order, but there we go. The first one is the GP or whoever you see at the GP practice will take a history and examination. They may want to do some blood tests, particularly checking your inflammatory markers, and they may want to do some imaging. And the imaging with the GP might just simply be just an examination and no imaging. It may be that you have some X-rays. And then as a rheumatologist, I might request X-rays, an ultrasound scan, or an MRI, depending on which joint we are talking about. Principles of treatment are we aim to control any inflammation and prevent discomfort, joint damage, and any disability. And how we treat any type of arthritis, particularly in inflammatory arthritis, is guided by the disease severity, and I'm talking about autoimmune inflammatory arthritis. So if you've got rheumatoid, I may treat you more aggressively. By aggressively I mean with stronger drugs, not aggressively roughly. If your disease activity is very severe. And certainly with autoimmune inflammatory conditions, we do a treat to target approach, which is we're aiming to reduce your disease activity and we're aiming to put you into what we call disease remission. And often with autoimmune conditions, you can have other comorbidities. It might increase your risk of heart disease. So we would look at the whole patient and see what can we do to address all of your different risk factors. And obviously, before we start you on any immunosuppressants, if that's what type of arthritis you have, we want to make sure that you haven't got any other infections that would mean that we couldn't, or other comorbidities that would mean it wouldn't be safe to immunosuppress you. And treatment is very much dependent on what type of arthritis you have, but you can have ones without drugs, so non-pharmacological, so diet, exercise, occupational therapy, physiotherapy, patient education, most of which have been discussed already today. And then there may be drugs, and it may just be simple as using non-steroidal anti-inflammatories. This is very much aimed at autoimmune inflammatory conditions, but maybe anti-inflammatories. We might use steroids. We might use some what we call disease-modifying anti-rheumatic drugs if you have an autoimmune inflammatory condition, and then we get into more sophisticated immunosuppression depending on the type of inflammatory arthritis you have. Surgery is usually reserved for when you're trying to prevent joint destruction, or if you're trying to restore function. So you might want to do a joint replacement, particularly more so in degenerative joint diseases. When should you go and see your GP? Well, I think if you have persistent pain or stiffness in the joints that lasts for more than a few weeks, swelling that doesn't go away, particularly if it's a boggy swelling, with pain, stiffness that lasts for greater than an hour, and tenderness of the joints with warmth potentially of the joint. If with all of these joint symptoms, you've also got fatigue that's interfering with your life, if there's difficulty moving or using a joint. And the reason is because early diagnosis, particularly for autoimmune inflammatory conditions, really can prevent joint damage and improve quality of life. There's lots of resources available. Obviously, there's Arthritis Research UK, there's the NHS, there's lots of different support groups. I will update this slide and I can put some more links. Unfortunately, I had a little IT mishap and didn't save just before the talk, so I've lost some of my slides. But there's lots of resources out there which we can signpost you to. And that's it. Whistle top stop tour.